I am an ME patient of around 8 years. My life has been destroyed by this illness. My life has been further devastated by the approach and demeanour of the UK medical profession towards myself due to the nature of the disease and continued endorsement of methodologically flawed research papers suggesting that such profoundly disabling symptoms are caused by deconditioning and a maladaptive thought process. Years ago, I had wished that this situation were the case, as fortunately there were promising therapies such as the lightning process and cognitive behavioural therapy to address such an issue. I have never been against receiving a mental health diagnosis, despite what some researchers may have their colleagues and the media believe about ME patients. But the fact is, I am against the distortion of evidence and the promotion of methodologically flawed research being portrayed as of high rigour and quality. Nonetheless, in my case, as is in the case of many patients with ME, these therapies did not improve symptoms of the disease. Common symptoms such as bladder incontinence, severe limb weakness, postural orthostatic tachycardia syndrome, auditory hypersensitivity, and lactate accumulation in my muscles after exertion were untouched by these therapies. However, CBT, when taught based upon the correct principles, is clearly a useful tool for coping with the devastating consequences of enduring such a life-altering illness, just as it would in cancer or chronic kidney disease. These patients, however, have evidence-based treatments to target the underlying molecular dysfunction. ME patients do not. And as such, CBT is being used in the wrong context, based upon an ill-founded, baseless hypothesis. The continued misuse of therapies, such as CBT, hampers the progression of biomedical research, because researchers from outside the field are under the illusion that these therapies are highly effective and based on the utmost level of scientific integrity. The reality is that they simply are not, and we need now more than ever for all our charities to support and represent the views of their patient members whose lives have been devastated by this disease. Then, and only then, can we achieve transparency and encourage researchers from outside this field to join and work with us, devoid of politics that have arisen directly as a result of the PACE trial and its authors' continual refusal to release anonymized data to qualified researchers.